In our College of Nursing at the University of Arizona, the faculty were looking at the data about the mix of students that we were having coming into our programs, and thinking that we didn't have as much diversity and inclusiveness as was sensible for us to have. Patients are very interested in having healthcare workers, and particularly nurses, who represent their cultures and backgrounds. And that wasn't necessarily the mix of people that have been in our discipline of nursing and who we're admitting to students, so that we can accelerate that we have more diversity in the nurses we're graduating. We received a grant from HRSA, a Diversity and Inclusive Excellence Grant from HRSA this year. And as part of that grant, it's accelerating our movement towards having consideration of holistic assessment as part of our admissions process. It has given us the opportunity to think more deeply about the kinds of criteria that would be more holistic in terms of admitting students. As part of that, we engaged in a workshop with the American Association of Colleges of Nursing to specifically have faculty consider what holistic assessment for admissions means. The outcomes of that workshop are that faculty will continue to dialogue on and ultimately finalize the criteria that we would use for our admissions. While many of our faculty were involved in the workshop, there's more discussion to be facilitated among faculty, and we're in a much better position to do that after the workshop. I think the outcomes of the workshop now will be that we will continue to have discussions among a broader group of faculty about what holistic assessment in our admissions means, how we finalize a group of criteria for us to change our admissions process so that it is a more inclusive process of the cultures and backgrounds that are underrepresented in nursing. For us in Arizona, because of where we're geographically located, there's an emphasis on making sure that we're admitting the best candidates who come from a Hispanic, Latino, and/or Native American Indian background. As well, though, we know that there are still students that apply to our college who are the first in their family to go to college, who come from rural, underserved areas and areas along the Mexican-American border that are in need of nurses and healthcare workers who represent the populations along the border. The process for us has been an enriching one, helping us to think more deeply about what we've emphasized with respect to admissions. There's a tendency to focus almost entirely on the what I call the intellectual quotient, or the intelligence quotient dimension, when we know that the best nurses are those who have a strong combination of intelligence quotient as well as emotional quotient, who are very people-oriented. I think we have evidence that says that the more diversity of voice that you have among a group of people, the more excellent the outcomes of what they produce. So the idea of holistic assessment as part of admissions to nursing school is incredibly important on many levels.